been using alcoves for over 4 years prior to my coming here. Last year there were questions that were asked by the fire department around the use of alcoves, and as you know, the reason we use alcoves is because of overcapacity. So we worked with the fire department last year and looked at the risk associated to alcoves, and because there's no doors that we can contain fire, it was determined that it was a fire risk. So we immediately looked at what are our alternatives, and as you know, we do not have the alternative to close our doors. So we decided to convert our patient lounges, and you've heard a lot about that. A lot of people were upset about that. That decreased our capacity of doing private interviews on the unit. Families that were grieving couldn't use them. But what we did, and we couldn't transfer our patients from the alcoves to the patient lounges immediately, because those of you who've been in the hospital understand that alcoves are right in front of our nursing station, and we have direct access. So moving them to our patient lounges, we had to do renovations. We had to put in some call belts. We had to put curtains in, and we accommodate two patients in these patient rooms. So we moved the last patient on November 4th. The inspection was done on November 1st, and as a result of that inspection, we received a summons in January. So I think that when you're looking at what are your alternatives, we felt that the alcoves were safe, that they were close to the nursing station. The nurses could observe the patient at all times. But when the fire department looked at this and said, look, there's no doors, there's a risk, we need to find alternatives, we worked with them to find alternatives. So this is really a question of overcapacity. If we were functioning at the number of patients we should have, we wouldn't have anybody in the patient rooms or in the patient lounges, but we no longer have patients in alcoves as of November 4th, 2013. So I'll entertain questions.